Back in another video tutorial from microbiology with Charnik. In this video tutorial I am going to provide you a short lecture video on five different type of virus, mainly viral disease caused by different type of virus. First one is influenza virus that cause respiratory illness. Second one is rabies virus, which is transmitted by our pets, and it is kind of neurological illness and it is very common to us. The next one, that is dengue. And the fourth one, which I have already uploaded a elaborated lecture, that is AIDS. And the last I am going to discuss about polio virus. Okay, so if you want to know about what is the cause of those kind of viral mediated infection, what is the symptoms, and what is the mode of transmission, and how we can get cured, or what is the treatment of that disease, or how we can prevent those kind of disease, what is the control measurement of that. So this video is just for you, so stay tuned and let's get started with that video. So the first thing that we are going to discuss about it is influenza virus. Okay, so remember one here. Okay, so influenza virus, I am not going to discuss about what is their virology part. We are going to discuss about only the disease part. So incubation period is 2 days within a range of 1 to 4 days, you can say. So symptoms mostly asymptomatic, but if some innate immune response is stimulated due to some pre-inflammatory cytokines, pro-inflammatory cytokines, then some symptoms can occur. You can simply remember this with the help of that influenza will simply infect the respiratory system. Okay, so any kind of cough, any kind of fever, headache that is associated with our respiratory system, all will be the symptoms of influenza virus. For example, I have divided these influenza virus symptoms into 3 parts. One is constitutional, another one is respiratory, another one is complicated. So for constitutional, we have 4 things: fever, chills, myalgia, and headache. Okay, so if you have cold infection, that is common in case of influenza, so what you get, you first get fever, right? So as I have written here, some chills, myalgia. So myalgia means what? Myalgia means muscle pain, and yes, we observe some kind of muscle pain when we have some cold problems, right? So headache, so it is easy to remember, right? And as I have told you, it is respiratory, so cough will be also occurred, sore throat, rhinitis. And if unfortunately the infection go into its complicated stage, then otitis media, that is a complication in brain, sepsis, sinusitis, pneumonia can occur. Okay, so do you remember, pneumonia can occur in 2 parts. One is viral influenza mediated, another one is bacteria superinfection. Okay, so superinfection can be caused by Staphylococcus aureus, Streptococcus pyogenes, Streptococcus pneumonia. Staphylococcus aureus along with methyl resistant Streptococcus aureus, that means those that are generally resistant to common penicillin, semisynthetic penicillins, and they are very common in our locality, right? Because it can be transmitted from the hospitals, it can be transmitted from anywhere. MRSA is nowadays very common to us. Now let's come to the mode of transmission. So transmissions from man to man, either by inhaling the virus, okay, or by touching the surface that was previously infected, without that is infected with influenza virus, then touching the mouth or nose. Infected droplet expelled into the air through coughing or sneezing. Okay, so how can we control them? So we can control them with the help of annual vaccination and good hygiene. So remember that vaccination thing is quite unfortunate for influenza virus, because vaccination development for influenza virus is not a joke. Because remember, influenza virus is a RNA virus, although we are not going to discuss it in very detail. So RNA virus So RNA virus require RNA dependent RNA polymerase for its replication, right? And it is, we all know that RNA dependent RNA polymerase do not have any kind of proofreading system, right? So as it not having any kind of proofreading system, so the error rate or mutation rate is very high. Not only that, remember one thing, that influenza virus is not a intact genome, okay? That means you do not get something inside the capsid just like that, a total part. It will be fragmented, okay? Fragmented, or more accurate term is segmented. So influenza have 8 segmented genome, right? And now just try to think about this, that if some cell, a particular cell is unfortunately infected by 2 different type of influenza virus, that means what? That means inside that particular cell there will be 16 type of different influenza genome, okay, in its cytosol. Now during the packaging, because we all know after the infection there will be a packaging, right? So during the packaging there can be genetic reassortment. Genetic reassortment means there can be, suppose 1 2 3 4 5 6 7 8, so 8 red genome I have drawn here, and 1 2 3 4 5 6 7 8 yellow genome I have drawn here, okay? So there can be a mixing between them, okay, and leads to the formation of say 4 red 4 yellow, or 5 red 3 yellow, and it will be packaged inside a virus, which results in what? Which result in generation of a new strain of virus. That is the reason that kind of thing promote pandemic, okay? So although it is a concept of antigenic drift, antigenic shift, that is the concept of virology, we are not going to discuss about it. So this is the concept, because it is often asked that why vaccination development against influenza is very difficult. So you have to write 3 points. RNA dependent RNA polymerase, which do not have proofreading activity, that is why it is too much erroneous. And second is the genetic reassortment facilitated by the segmented genome, and another one is the continuous change of their surface markers because of the mutation, okay? So now how can we treat this? So remember one thing, now I have to touch a small part of the influenza virus replication and how they get inside. So remember, suppose it is a cell, okay? So via a receptor, this receptor is terminated with sialic acid, okay? So this receptor will promote a receptor mediated endocytosis to the virus. That means obviously virus have something that can interact with the terminated sialic acid receptor. Yes, the receptor that virus have is hemagglutinin. We are not going to discuss about this in details. Just remember that hemagglutinin is present in the envelope of influenza virus, because influenza is a enveloped virus, and it helps in the receptor mediated endocytosis. And inside the cell, if a virus enters inside the cell via receptor mediated endocytosis, that means the virus will be engulfed by a vesicle inside the cell, right? And now the lysosome will come, and lysosome have digestive particles and acidic environment, but unfortunately this virus have the ability to use this acidic environment as its own purpose. Although bacteria have developed it, or our cell, so not bacteria in that case, cell, our cell is developed that acidic environment to destroy what our cell by chancely take from the outside, okay, if it detects it as a foreign. But unfortunately influenza virus have the ability to use this acidic environment for its own purpose, okay? So there is a channel named M2 ion channel. Influenza virus use this M2 ion channel tetramer to take up those protons, we all know proton means acidic, right? So those proton inside. So what those proton helps in influenza virus, how they helps influenza virus? So they helps influenza virus in the uncoating process, right? Because just by getting inside the cell will not solve all the needs of influenza. It need to uncoat itself so that the genome of influenza virus can take up the host cell machinery and use that host cell machinery for its own purpose, right? So for this, it first need to exposed into the cytoplasm, right? So for that purpose, it uses the acidic environment. So this acidic environment will helps in the uncoating process, and it is taken up by M2 ion channel tetramer. Now think, if somehow we can block that M2 ion channel tetramer, then it will be very good for us. So yes, we have two drugs for that, amantadine and rimantadine. Amantadine is a tricyclic amine that have the ability to block M2 ion channel tetramer. But amantadine, remember, unfortunately have some side effects such as insomnia, ataxia. Okay, so these side effects are predominant in older patient, and unfortunately influenza is also predominant in older patient. So for older patient, we choose rimantadine instead of amantadine. Okay, although the function is exactly the same. Another one is neuraminidase. Remember, neuraminidase is another type of receptor present on the envelope of influenza virus. This neuraminidase play a important role in the release of the virus. Okay, if neuraminidase is not present or neuraminidase is somehow blocked, virus cannot removed or virus cannot comes out from the infected cell. As a result, the newly made infectious virion will be trapped inside the cell. That is why we have also developed a drug inside against them, and that is oseltamivir and zonamivir. And remember, oseltamivir also referred to as Tamiflu, and zonamivir is referred to as Relenza. So that is how treatment is done, and diagnosis can be done influenza specific RNA with the help of RT-PCR. Okay, so that is the topic in case of influenza virus. Incubation period 2 days, and the overall range is 1 to 4 days. Cause is very simple: direct transmission from man to man, either by inhaling the virus or by touching the surface that is previously infected with virus. And a infected person can also expel droplets that contain influenza virus in the air, and that can facilitate influenza virus spreading. So we can control this with the help of annual vaccination and good hygiene, and symptoms are flu-like symptoms. Okay, so now let's move to the next topic, that is rabies. So rabies virus is generally spread by our pets. Okay, it can be transmitted from pets to human, or human to pets to pets. Okay, so before going to talk about the symptoms, I am going to discuss with you about a very simple thing, that their incubation period is very high, 3 to 12 weeks. Okay, and this incubation period can be in some cases just only 5 days, and can be in some cases the total 12 week. Why? Because remember, the closer the bite is to the brain, the faster it will appear. Okay, so that means if your pet bite you in your leg, then the distance from that bited part from your brain is higher or is longer than if your pet is bitten you in your hand, right? So in the second case, the incubation period will be smaller than the first case. Okay, so we have developed the symptoms, or we have divided the symptoms into four parts. One is incubation part, another one is prodrome part, acute neurologic syndrome, and coma and death. Okay, so let's discuss one by one. So I have already discussed incubation, then let's move to the prodrome. So remember, in prodrome phase the symptoms are quite like flu like symptoms. Okay, for example, cough, headache, fever, then discomfort at the site of bite, nausea, sore throat, feeling unwell, anxiety. Okay, so now let's move to the main part, that is acute neurologic syndrome. First of all, confusion, aggression will occur, partial paralysis, involuntary muscle twitching, rigid neck muscle, difficulty breathing. This point is very important, that is hypersalivation, and fear of water. That is also another important and trademark of our rabies virus. Hallucination, nightmare, insomnia, priapism or permanent erection, that is especially in case of males, and photophobia, breathing become rapid and inconsistent. That means there will be a breathing problem also. Okay, so that is the acute neurologic syndrome. So let's revise with me. Confusion, aggression, there can be partial paralysis, involuntary muscle twitching, rigidness in neck. Okay, then difficulty in breathing, the main trademark hypersalivation. That is why we have also observed fear in water, because remember, whenever a rabies infected person see water and thought about swallowing it, it fears itself, because as it is there, the hypersalivation is occurring, the swallowing becomes very difficult. That is the reason fear of water is observed, along with hallucination, insomnia, priapism or permanent erection, photophobia, and breathing become rapid and inconsistent. So now, if the patient have reached the coma or death and still untreated, then unfortunately there will be particularly no hope for that patient. There are very low chance of recovery, and they will immediately die, or their death will be some matter of hours if ventilators are not attached with them. Okay, so diagnosis. So we diagnosis the saliva samples, because hypersalivation is occurring. So if we can find out any unusual salivation, then we can get a idea about rabies. Blood sample testing, spinal fluids testing, skin sample testing from the wound part. So here we are detecting the proteins that are present on the surface of rabies, or also the viral detection, virus demonstration of antibody response, and the genetic material of the virus determination. Okay, so that is how diagnosis is done. So what should be the treatments? So treatment is, first of all, washing the bitten part or scratched part for 15 minutes with the help of detergent or povidone iodine or soapy water. So it will reduce the number of viral particles, and that will help us to recover. Fast acting dose of rabies immunoglobulin, it is important, and a series of rabies vaccine for next 2 to 4 weeks. Okay, that is why we have received 24 injection after whenever we have suffered a bite from dog or anything, right? That is the reason rabies vaccine is given over the next 20 or 2 to 4 weeks. A series of rabies vaccine is given over 2 to 4 weeks. Okay, so that the patient's immune system can fight against the rabies virus. Mode of action: spread of saliva of infected animal. So by biting a human, not only biting, by touching the saliva onto a open wound through mucous membrane. Okay, that means mouth or eyes. Rabies virus can also enter through the mouth or eye. So that is the concept regarding rabies virus. So symptoms are divided into 4 parts. One is incubation period. Incubation period is 3 to 12 weeks and completely depending upon the distance between the cut site and the brain. The second one is prodrome, that symptoms are quite related to what we observed in case of flu symptoms. Then the main acute neurologic part. 4 symptoms you must have to mention whenever they are talking about acute neurologic symptoms. So first one is hypersalivation, fear of water, fear of light. Okay, along with you may attach partial paralysis, that is rigidness in neck, involuntary muscle twitching, coma. Coma is also the second next stage, so not you will not attach here the coma part. Instead of coma you can use confusion, aggression, hallucination, nightmare, insomnia, trapezium or permanent erection. Then death occurred if they are not attached to ventilation. Then diagnosis for diagnosis part, saliva detection, because hypersalivation is occurring, along with wound part detection, that is skin sample detection, blood sample and spinal fluid detection. Here we are just finding out the presence of protein that scientists actually observed in the surface of rabies virus. Okay. Then treatment, washing bites or scratches for 15 minutes, detergent, povidone iodine, soapy water to reduce the number of the viral particle, and fast acting dose of rabies immunoglobulin. A series of rabies virus is administered up to 2 to 4 weeks. Okay. Then mode of transmission, spread via the saliva of animals, we have discussed. Now let's move to the dengue part. So dengue is a viral infection that is commonly spread by Aedes aegypti and Aedes albopictus. Mode of transmission is by mosquitoes. Okay. So now we have developed, or we have divided the symptoms part into 3 steps here: febrile phase, critical phase, and the last one is recovery phase. Although for every person you may not observe the critical phase, it is very rare. Okay. So febrile phase occur 4 to 7 days. Within 4 to 7 days of infection you may observe fever, you may observe headache, you may observe retroorbital pain, you may observe thrombocytopenia, you may observe lymphadenopathy. Lymphadenopathy means inflammation and enlargement of the lymph node. Then macropopular rash, then nausea, vomiting, diarrhea, etc. can be observed. So critical phase, that is not common to every patient. In that case, thrombocytopenia, that is bleeding, dengue hemorrhagic fever, vesicular leakage, that is shock organ impairment, dengue shock syndrome, and occurred in second infection with other serotype and patient with comorbidities. Recovery, eruption of the new rash and chronic fatigue. Okay, that means rash that we have observed in the first case can return during the recovery phase. Okay, and chronic fatigue may observe, and another symptoms starts to recover as the time increases. Okay, so modes of transmission we have discussed. Control, vaccination, although vaccination will not provide full protection but it can reduce the symptoms. Okay, prophylaxis, what are the treatment? So anti-dengue IgM detection, with the help of that we can detect whether a person is infected or not, and for that purpose we generally prefer ELISA technique. Okay, mainly the sandwich ELISA. So anti-dengue IgM detection during the day 4. Supportive, although our immune system have the ability enough, or a person with a good immune system can recover from dengue himself, he or she just need a supportive care for fast recovery. Okay, although for reduction of the symptoms you may use acetaminophen, but ibuprofen is not used nowadays because it facilitates anticoagulation. So incubation period 3 to 14 days. So that is the concept regarding dengue. So the dengue virus, we have divided the dengue virus into symptoms into three parts. One is febrile phase, another one is our critical phase, and the last one is our recovery phase. In febrile phase occurs during the 4 to 7 days of the symptoms. In that time, lymphadenopathy, thrombocytopenia, fever, headache, retroorbital pain may observe, nausea, vomiting, diarrhea may observe. Critical phase, in critical phase we can observe thrombocytopenia and vesicular leakage occur in second infection with other serotype. That is another important thing. Patient with comorbidities, and in case of second infection with other serotype, critical phase may observe. Okay, and the recovery part, eruption of the new rash and chronic fatigue. So now the third disease that we are going to discuss about, that is AIDS. So I am not going to discuss about AIDS in very details, because we have already discussed about AIDS in too much detail. There are videos for AIDS that can help you to learn about AIDS everything. Okay, so we are going to just showing you the short note that I have made, so that you can take a screenshot. Okay, so the inhibitor that is used for integrase, it is raltegravir, in case you may not understood what I have written. Okay, so now today's last one, that is polio virus. Okay, and there will be one virus more, that is hepatitis virus, that I will also upload within a week. Okay, so polio virus generally multiplies inside the intestine. Okay, and it can evade the nervous systems and can cause paralysis. That means here we are going to deal with again another neurological disorder caused by virus, right? So another virus that we have discussed about that caused neurological problem was rabies, right? And now we have to face the polio virus. So let's start. So I will divide polio virus into three parts. Okay, one is paralysis causing polio or paralytic polio, another one is non-paralytic polio, some may also call it as abortive polio, and last one is poliomyelitis. Sorry, the last one is polio encephalitis. Okay, these three type of polio, and another one is post polio syndrome. That means after recovery you may observe some symptoms related to polio in that case. Okay, that means polio can occur again if a person is previously infected with polio virus. So let's discuss about the mode of infection. So this virus is highly contagious, mainly from person to person through the infected fecal material entering the mouth, through contaminated food, water, and through contaminated food or water which is contaminated with human feces. Okay, so if you are living with anyone who are having polio, then there is a chance you can have it too, because it is highly contagious. Okay, along with malnutrition, person with malnutrition, skeletal muscle injury due to vaccination, immune deficiency, pregnancy in young age, those kind of individuals are more susceptible to polio. And if unfortunately you are not vaccinated to polio, in such cases, if you are a researcher and you are handling polio virus in laboratory, then you may at risk. Then taking care or living with someone who are having polio is also a risky factor for non-vaccinated persons, and traveling to an area where polio outbreak is occurred can be very dangerous. Okay, so that is the mode of transmission. So highly contagious, can be transmitted from person to person through infected fecal material, or by eating food which is contaminated with fecal matter, or by drinking water which is contaminated with fecal matter. Okay, So symptoms, as we have developed or divided the symptoms into 4 parts. So first we are going to discuss about non-paralytic polio. Remember, in non-paralytic polio no paralysis is occur. So you may observe fever, vomiting, you may observe headache, you may observe back pain, abdominal pain, neck pain or pain in arm, along with fatigue and irritability. Okay. In case of paralytic polio, fever, headache is common again, along with loss of reflexes, may observe deformed limbs, especially in the hip, ankles and feet. Sudden paralysis which may be temporary or permanent, and severe muscle aches and weakness. Okay, and loose and floppy limbs, sometime on just one part of the body. Okay, so that are the symptoms for paralytic polio. You may remember in such a way that in case of non-paralytic polio you don't going to have any kind of paralysis, but fever and headache is common in both the cases. But as in case of non-paralytic poliomyelitis, you do not going to have any kind of paralysis. Instead of that, you will observe pains. Okay, that means pain in various parts of our body that is somehow connected with our nervous system, such as abdominal pain, such as back pain, neck pain, pain in joint, pain in arm, fatigue, etc. This is common for non-paralytic poliomyelitis. And in case of paralytic poliomyelitis, along with fever and headache, as it is going to cause paralysis, that means loss of muscle reflexes. Okay, along with severe muscle aches and weakness is observed, along with sudden paralysis which may be temporary or permanent, and deformed limbs, especially hips, ankles and feet. Okay, so now polio encephalitis, that is inflammation in the gray matter of brain, that is very rare, and it is again neurological. So coma, stupor, irritability, delirium, agitation may occur. So sorry for that. Okay, so muscle pain that get worse in case of post-polio syndrome, along with fatty acid fatigue, along with decreased tolerance of cold temperature, along with muscle wasting, that is known as muscle atrophy, along with breathing and swallowing problems, along with our sleeping disorder, sleeping apnea may occur. Okay, so symptoms, we have divided symptoms into 4 parts. One is non-paralytic poliomyelitis. For non-paralytic poliomyelitis, I have told you that along fever and headache, various pains such as back pain, pain in arm, then you may observe pain in neck, pain in abdomen, then meningitis, that is another inflammation in brain, and then fatigue. Okay, so paralytic poliomyelitis, in case of paralytic poliomyelitis, you are going to observe paralysis. Okay, that means muscle will start losing its reflexes. So loss of reflexes, fever, headache, severe muscle aches and pain, weakness, obviously there will be a pain in muscle. So loss and floppy limbs, sometime on just part of the body, and sudden paralysis which may temporary or permanent, deformed limbs, especially in hips, especially in ankles and feet. Okay, polio encephalitis, this is the most rare one. Remember, here inflammation in brain occurred, then for that case you may write about your stupor, coma, irritability, delirium. So now post-polio syndrome, for post-polio syndrome, muscle pain that get worse, fatigue, muscle wasting, also referred to as muscle atrophy, breathing and swallowing problems, and sleeping disorder, sleeping apnea, decreased tolerance of cold temperature. This is very important. So now that let's talk about diagnosis. So as it is completely a paralysis related problem, so we are going to check with the help of some physical examination the stiffness of neck and back, along with some abnormal reflexes will also be checked, and difficulty in lifting the head while lying flat. This is the various kind of check that we have to done as a diagnosis. Also that testing of sample for throat and secretion of stool and CSF is also checked. Okay, that means physical examination is main, that will check the rigidness in neck and back, okay, or stiffness in neck and back, and abnormal reflexes along with difficulty in lifting the head while lying flat, and testing of samples of throat secretion, stool, CSF is also observed. So treatment: bed rest, painkiller, using pads, heating pads or warm towels to ease muscle aches, and therapy. Because remember, here we have discussed that deformed limbs of hips, ankles, feet is the symptoms, right, of paralytic polio. So we use or we take the help of physical therapy so that we can get relief from those muscle deforming or muscle deformity, and it will also help us to prevent loss of muscle function. Okay, vaccination: children from 2 months, 4 months, 6 to 18 months, and then 4 to 6 years will get the polio vaccination according to Center for Disease Control and Prevention. Okay, so here another important concept that you need to know about the oral polio vaccine. Another one is your inactivated polio vaccine. So remember, oral polio vaccine is administered orally, and that in oral polio vaccine, which is also known as sabine polio vaccine, here no injection is required, so it will obviously be less expensive and it will generate a good immunological response in the intestine. Okay, and that is very good for us, because I have told you at the beginning of the polioviral lecture, that is, it will multiply in the intestine. So if we immunized our immune soldiers in the intestine, so it will definitely be helpful to us. But as it has some advantage, it has some disadvantage too. It may cause vaccine associated paralytic polio. Okay, because vaccines mean what? We are just adding the poliovirus in a attenuated manner, right? So it may cause vaccine associated paralytic polio for that person who have a less immunological power. So that is the part. So that is why for those person who are immune compromised, instead of oral poliovirus, inactivated polio vaccine is preferable. Although it requires the use of injection, although it may not generate a good immunological response in your intestine, but here we are using inactivated polio vaccine. Remember it. That means inside your body it cannot replicate, right? So it is quite safe for those immunocompromised person or those person who have immunocompromised person in him or her family, right? Because remember, poliovirus is highly contagious, right? So if somehow a person who have a good immune response develop the vaccine associated paralytic polio, it may have the ability to spread to someone in its family that have a weak immune system. As a result, he or she in his or her family may develop the vaccine paralytic polio, which may be dangerous. That is why for those kind of person, inactivated polio vaccine is used, and inactivated polio vaccine administered intravenously with the help of injection, and it is highly expensive. It may not generate a good immune system in the gastrointestine, but the advantage is it will not cause any kind of vaccine associated paralysis. But it has disadvantage too, that recipients could infected with wild type poliovirus, that is completely prevented by oral polio vaccine. Okay, so that is how vaccination is developed. There is a very famous question from poliovirus treatment part, that is, what is the difference between oral polio vaccine and inactivated polio vaccine. Okay, so that is all for poliovirus. So we have discussed that poliovirus generally multiply in the intestine and then they evade the nervous system and cause paralysis. Mode of transmission: in mode of transmission we have discussed that it is highly contagious. It can transfer from person to person via infected fecal matter that enters through the mouth, or by ingestion of food that is previously contaminated with, or that is contaminated with fecal matter of human who was infected with poliovirus, or drinking water which is contaminated with human feces. Okay, and mainly the person with malnutrition, skeletal muscle damage or injury due to vaccination, immune deficiency, pregnancy in young age are susceptible to polio, and those persons who are not vaccinated may also develop polio if he or she is a microbiologist and handling the poliovirus in the laboratory, along with if he or she taking care of someone who is infected with poliovirus, and if he or she travels in an area where poliovirus outbreak is going on. So in that case, those persons are at a high risk. So symptoms, we have developed non-paralytic poliomyelitis. For non-paralytic poliomyelitis, paralysis is not going to work. So fever, headache along with various kind of pain, right? For example, meningitis, for example, pain in arm, for example, headache, back pain, neck pain, fatigue. For paralytic polio vaccine, along with fever, headache, loss of reflexes, severe muscle aches and weakness, loose and floppy limbs, sometimes on just one part of the body, sudden paralysis which may be temporary or permanent, deformed limbs, especially hips, our ankles and feet. Polio encephalitis, which is very rare and cause inflammation in grey matter, cause agitation, stupor, coma, irritability, delirium. Post-polio syndrome, muscle pain that become worst with time, fatigue, muscle wasting, also referred to as muscle atrophy, breathing and swallowing problems, sleeping disorder, sleeping apnea, along with decreased tolerance to cold temperature. Okay, so diagnosis, with the help of physical examination, we are just seeing here stiffness in neck and muscle, abnormal flexibility or abnormal reflexes in muscle, difficulty in lifting the head while lying flat, testing of samples, throat samples, stool samples, CSF. Along with that, we may observe treatments also, that is bed rest, painkiller, portable ventilator to help with breathing, and physical therapy to prevent the loss of muscle function, along with deformity that we have discussed, deformity in limbs, right? Heating pads and warm towels can also can also be used to get relief from muscle aches, along with vaccination. So here vaccination, we have discussed about what is the difference between oral polio vaccine, also known as sabine polio, along with inactivated polio. Okay, so that was the 5 disease that we have discussed today, that is poliovirus along with AIDS. Then we have discussed about the dengue, along with we have discussed about rabies and influenza virus. Okay, so I am going to discuss about another important virus associated disease in our next video, that is hepatitis. Okay, so with the help of that, we will wrap up all the important poliovirus, all the important viral disease, because they have just want us symptoms, mode of transmission, prophylaxis and control. So we have discussed polio, rabies, dengue, AIDS, influenza. We have left only hepatitis B virus, because remember here they have just want swine flu, Ebola, chikungunya, Japanese encephalitis as a brief description. So here we may take our suggestive way. Okay, we have discussed about those 6 important virus elaborately, then this remaining one we will discuss in a suggestive manner. Okay, so last one that I am going to upload, that is hepatitis viral associated disease. Okay, so I hope this video will be helpful to you, and if it is, please hit the like button, share with your friends and subscribe to my channel. And thank you for listening to this class.